If I can change anything about my body, I'll have wings because I can fly to McDonald's.
I would change my legs into a mermaid tail so I can swim like a mermaid.
I would change my legs, like my thighs, make them a bit slimmer.
I thought labia were like fingernails, like they had no sensation. So I tried to cut them off with kitchen scissors when I was 12.
At what age do we stop wishing for magical things for our body and start wishing to change body parts that function perfectly well to fit society's idea of beauty?
We all look completely different, and we shouldn't feel shame because media or society has given us this idea of what we should look like.
What started off as a vulva gallery has turned into a global movement helping people open up communication with sexual health and sexual education.
I don't want to change anything.
I'm Ellie Sedgwick, and welcome to Comfortable in My Skin.
This podcast episode is sponsored by TAP Health, which is a women's health wellness brand redesigning how people experience pelvic pain and access relief at home and on the go. So TAP 2 is their latest wearable TENS device designed to support people navigating painful periods, pelvic pain, endometriosis, bladder overactivity, back pain, and more. It makes evidence-based pain relief portable, recharging, and easy to use in everyday life. TAP has been founded by an occupational therapist who experienced lifelong pelvic pain and designed this in consultation with pelvic health physios and experts. TAP 2 is preset to research-based modes, which we will talk about in the podcast, and that pelvic physios use every day with their patients and comes with over 11 different ways to wear the standard kit alone. TAP 2.0 is listed with the TGA, endorsed by pelvic health clinicians across New Zealand, Australia, and the UK, and it is stocked by over 60 clinics across New Zealand, Australia, Hong Kong, and the UK. It's really discreet. You can wear it under your clothing, and it's easy to use on the go. I'm actually wearing it now, and I'll show you later in the episode. And TAP 2 really is helping thousands of people feel more supported and in control of their pain. Ellie will have the details with their website. It's www.taphealth.nz. You can use a code they've kindly given us. It's called Comfortable20 for 20% off the TAP 2.0 TENS as a gift from them, which is just so lovely. I absolutely thought of them for this episode.
So today's guest is Amelia Godfrey. She is a physiotherapist, and would you like to introduce yourself?
I'd love to. So I'm a pelvic health physiotherapist, which means that I work with people with pelvic health conditions, which we'll talk about today. And I have also founded the Pelvy Patient app, which we will also chat about. But essentially, my job is to help people with a range of pelvic health symptoms. And I've made the app so that people can access our care and be supported to do the exercises.
Great. It's called Pelvy, and I love it.
Yeah.
And it's only $20 a year. I'm going to plug that right now because it's so affordable.
Yeah. I luckily, so clinicians can subscribe to it. So I do have, income from that perspective, and it made me be able to make it really cheap for people trying to access pelvic health care.
Great. So what actually is pelvic floor dysfunction?
Yes. So pelvic floor dysfunction is where the muscles aren't doing what they should. So it might be that they're not good at squeezing, not good at relaxing. The coordination, like the mind-muscle connection, could be really off. And that can affect us in so many ways. So the pelvic floor, it does surround, I've got my pelvis here, it does surround all the organs. So your bladder, uterus, and rectum. And essentially, if these muscles aren't doing what they should, it can affect your bladder habits, bowel habits, and sexual function, and much more.
They're all three really pleasurable things in life, like peeing, pooping,
a good poo.
Pleasure.
Yeah.
Take that away.
How affects everything.
It affects everything.
Mm-hmm.
They're three things that when you do, you feel really good. So it's something that I think people need a lot of help with in life. And I just hope this episode shows people that we can help you.
Yes.
So what's the difference between that and pelvic pain syndrome?
Mm-hmm. So pelvic pain syndrome is where something is causing pain within the organs that I've mentioned. And people with a penis can have pelvic pain syndrome as well. So although they don't have a uterus, they can experience pain around the prostate area. And they also people tell me, well, oh, this must just be for women. It's like men have a bladder and a rectum and a pelvic floor. And so pelvic pain syndrome is pain anywhere around the pelvis. And that could be the front, the back, even your lower back is connected to your pelvis. Your inner thighs are connected there. And it can affect the organs, the nerves, which are everywhere, the skin, and of course, the muscles.
Do you feel like men feel more shame coming to you than women?
There's definitely, I mean, there's less pelvic health physios that see men, but of course it's less known about even with professionals. So many, most of the men that I've seen, they've seen many specialists and they've had to really find out about us through like Reddit forums.
Yeah, I believe that, because I imagine like they might be worried about things getting a boner if you touch them in certain ways, or that, you know, they feel, I just feel like they'd feel a lot of shame, really.
Yeah, it's just I think also if you're going to someone of the opposite sex and you're just nervous to talk about the symptoms that you're having, I think men are less likely to express what they're feeling and to feel comfortable sharing details about wee, poo, and sexual function. So yeah, I really try to make them feel as comfortable as possible. Luckily for males, we can use a ultrasound machine to assess them. We can place that like underneath the testicle area, so you don't have to touch anything. Like I could literally have my patient place the probe if they really wanted to, and they can be covered, and we can just look at the screen to look at the muscle feedback and movement. So yeah, it's really important to be able to meet the patient where they're at and do an assessment, offer all different ways of assessing, and to do what they feel comfortable with, especially when you're just meeting them.
Yes. So what kind of things do you see commonly that people have with pelvic pain?
Yeah. So I mean, I definitely see a lot of people with reproductive pain. So they might might not have a diagnosis of these things, but it can sound really obvious to us when we understand all the symptoms they're having. But it can be endometriosis, adenomyosis, PMOS, which was PCOS. So, and of course, you can have pelvic pain that just stems from reoccurring thrush. You could have a fracture, like falling on, or pain, just trauma falling on your tailbone. There's so many reasons why you might have pelvic pain, recurrent UTIs, and then that becomes something that has affected your pelvic floor, and now it just still feels like you have a UTI even though it's been treated and you don't. Pelvic pain is really quite common for people that have hypermobility, and that is a spectrum. So Ehlers-Danlos syndrome is more known for that as a condition, but like I'm hypermobile very mildly, and it does affect me. And it's because your ligaments and everything are much more stretchy. So your muscles really do have to work a lot harder to like stabilize all the joints, and they can get quite sore.
Oh, there's just so many. I mean, I relate even to, I have PMOS. As someone who has endometriosis and PMOS, at what point should someone come to you? Like when the symptoms get so bad, or?
I mean, ideally, so I've done a lot of pelvic pain courses and training, and what I've realized is the longer you have this and the more organs that are involved, the longer it can take to find like really significant improvements. To be fair, I've found the opposite sometimes, but essentially like it's never too soon. Yeah. I think even if you are someone who hears about the episode today and you think, oh gosh, like I don't have symptoms, but I'd love to have an assessment, that's great as well. I see patients like that who they've heard from a friend or a family member to go get themselves checked. And then, I've never had someone who hasn't walked away feeling like they've learned something. And it's always great to, even though you think things might be normal, like often there are some bad bladder or bowel habits that could be refined.
Yeah. What are the signs of a tight pelvic floor?
So lots of different signs. So I'm just going to use the pelvis here. But essentially, some people can have just pain around the area. They might not have pain at the area, but it could be like referring down their leg or in their inner thigh. It can almost feel like on the inside of those hip bones here. And you can have it only as tailbone pain as well, because these muscles really do pull on the tailbone if they are quite tense, and they're shorter when they're more toned. Other signs could be you might not feel pain like at rest, but you might have issues with emptying your bowels, your bladder, and with trying to insert anything vaginally. Even some people can have pain or discomfort that comes on with arousal, and they can have real significant orgasm changes as well.
Or inserting a tampon must be quite painful for those people.
Yeah, so we ask questions about, like, you know, especially if some people aren't sexually active or they've never been sexually active, it's like, have you ever been able to or ever tried inserting a tampon or a cup or a finger for any reason? And they'll usually say they don't because of an experience where that wasn't comfortable for them.
What does the discomfort feel like?
Oh, I mean, it can feel like so many different things. It can feel like there's just a block and like you're hitting a wall and you can't insert the thing. It can feel like quite burny. It can feel like something's like tearing. And there are, with prolonged pelvic tension and pain, there are some people, hello, this is Veronica the vulva. There are some people who will actually have just pain with touch around the entry of the vulva here. And that is something that is really important to get treated, and your pelvic health physio can help with that, or a GP that specializes in women's health, or a gynecologist. Because imagine if you have tissues, they look healthy, but they're actually sore to touch. That's not normal, and that means that the nerves are, or even just the receptors here, they're registering touch as pain instead of touch as just touch. And we can actually help convert those back to touch receptors. But naturally, I have people say, I've tried doing the exercises, I've tried using, you know, pelvic floor wands and doing my own thing. And then I'll learn, well, of course you were not able to relax your pelvic floor when inserting something because it feels like your skin is burning. And that is something that is unfortunately very underdiagnosed.
Is that called vulvodynia?
So yeah, essentially we have this line here. Anything to the middle of that is called vestibulodynia, and that's definitely more common than vulvodynia. But vulvodynia is, anywhere around the vulva that feels pain with like a deep touch. So I'll have many patients where I might go to assess if that's the assessment that they've felt comfortable having. And like, I haven't even inserted my finger or stretched any muscles or pressed on any muscles. And they'll literally will recoil. Be like, oh, and you know, it's like, oh, okay, that's not even your muscles there. So, and it can be treated.
What kind of treatment does it need?
Oh my gosh. So firstly, like if you're in Australia, I would love that people know about these government funded endometriosis and pelvic pain clinics. Yes. Those GPs have been working so hard for the last few years since gaining that funding. And this is the bread and butter, is to help with vestibulodynia. There is a bit of a wait list. So and you don't need a referral. You can just find out, Google it, find out where your closest one is. I worked at the one in Darwin, and we serviced the whole of the Northern Territory. So you don't even have to be local to get care. If you're within that catchment, you can have help. And essentially they have funded appointments, and they will take the time to really find out not just about a few symptoms, but your whole history. And that's really important with pelvic pain. And essentially, there are some oral medications, some cream options, and there are options with physio as well, where we don't have to do medications. From my experience, I would say that it's been about 50-50 which one works. I've done medications first, and then I've done the physio options, and I've done the physio option first and not had to do the medication option. I think the main thing is that there are options, and it's worth persevering to figure out what the right thing is for you. But the thing that I love about what we can prescribe is vibrator therapy. I knew you'd love that. And essentially, like, there's importantly vibrators that they have quite a nice broad surface area, and you can just even have it on the outside of the vulva and give very gentle vibration. It shouldn't be uncomfortable. It's not going to help if it's uncomfortable. And we just want to have vibration for 15-20 minutes 3 times a week. And that's for at least 12 weeks. And that honestly can really help just calm the nerves down and help them convert back. And then you can be like, only when you're ready and you feel like it's not painful, then you can use something that's a little bit more specific towards the entry. But yeah, once again, everyone, like, it's really helpful to have a pelvic health physio guide you. I think I'm just trying to talk about these things because I know it's a privilege to say that, because not everyone has a physio that is experienced in pelvic pain. There are really big wait lists in the hospital system, and even in the private clinic. We can have 3 to 6 months wait to get in with certain physios in the clinic I work in.
And how long does someone usually need to work with a physio?
Look, I really would say it's super dependent on the person. It's dependent on how good they are at doing the exercises as well. And it depends how often you can come. So for example, if I could see someone weekly, like we're supposed to see a meaningful change within 6 weeks. Yeah. And if there's no change in anything, we might not be on the right track. And just like any health professional as well, sometimes we need to change and see a different one in the clinic because their approach works better than the approach I had, for example. But research does look at pelvic physio and how effective it is, and usually it takes about like 8 to 12 appointments. I would say though, if those are really spaced out, it's much harder to have a really significant change. Because imagine if I saw you and I just gave you some breathing exercises for a month and, you know, you probably would get distracted or like lose motivation because you're not going to see change because we haven't really done much yet. Does that make sense?
Yes. But you kind of need someone to walk your hand through the experience.
And there are some people that they've literally have had such a change within like 1 to 3 appointments. Or, you know, they've seen us and we've recommended something that the GP prescribes and they get like better really quickly. So you never know.
Is it possible for someone to come in and get a scan and it be totally normal, but they know that there's pain? Like, how do you diagnose using a scan?
So there are scans for endometriosis, adenomyosis. They're called deep infiltrating endometriosis scans, so DIE scans. They need to be done by a like really, really trained women's health sonographer. And they still don't pick up all cases of endometriosis, but unfortunately there are many patients that they will go under and have surgery and the surgeon will find that there's no endo, no adeno, and it leaves the patient feeling really upset because there's no obvious explanation for their pain. But the reality is there are a lot of painful reasons for pain, and it's the nerves, it's the muscles, it's your nervous system as a whole, the tissues, the organs can be sensitized. It's not necessarily that there's endo there. So when they're talking about scans, that's probably what they're talking about, is that type of scan.
It seems crazy to me that it's hard to find people that know how to do this scan.
It takes a lot of training, and, you know, I would say as a sonographer, I could imagine like if you're scanning people with pelvic pain all day, like these people really want the scan done, but these people have a lot of pain. They might not be able to insert something vaginally and you have to insert this probe. Like I think it would be actually a really tough job to do because you're scanning people vaginally who have a lot of vaginal pain and trauma. So I wonder like if that's a thing as well. But yeah, there's been so much more awareness lately, and I think more and more people are interested. And so it's a really great non-surgical option for diagnosis, especially.
So I guess with endo, the way they sort of diagnose people without having to go inside of them is just say, like, if you're so sick you can't go to school, if you're so sick you can't go to work, and you are reporting pain so bad that it's disturbing your everyday life, then you have endometriosis until proven otherwise?
Well, there are definitely telltale symptoms, and that's what these funded pelvic pain clinics are amazing at picking up. So the one that I worked in especially, it was like, well, we didn't have for a while, we didn't have anyone trained to do those scans, and we didn't have any specialists that were good or trained to do endometriosis. They did all types of surgeries. They weren't specialists in endosurgery. And so we really lacked resources there. And essentially, like, the doctors would say, like, I would presume you have endo. Like, I believe you. These are the symptoms. Let's try this medication option that helps people with endo, and we'll go from there.
What's the medication option?
Look, I can't really speak about medications too much because, I definitely don't want to spread things that are out of my scope. But essentially there's lots of amazing options that have now come on the PBS. So they're really discounted for Australians. And like, going to a gynecologist that is an expert at endometriosis is so key. And those endo clinics, we shouldn't just be treating the endo, we should be also treating the nervous system if that's needed, and the tissues if that's needed. Like we talked about the vaginal hypersensitivity. There are just so many options for people, especially with period or cyclical pain, that patients don't realize. There's medications to relax muscles, for like really good anti-inflammatory options that are better than just like an oral anti-inflammatory. Yeah, there are great medications. I would definitely recommend going to the Pelvic Pain Foundation of Australia website. They have a medication section there. They don't have all of the ones that I'm describing, but they do have quite a few. And you can always show that to your GP. And that GP should reach out to the local pelvic pain and endo clinic and find out how to prescribe that.
Great.
If they don't know. Yeah.
Isn't it funny? I was diagnosed with PMOS in 2012, and I've had endometriosis since early 20s. But I've just never found someone that could help me. Like, they just diagnosed me, and then I walked out with the sheet, and then that was it.
I know.
So it's so great to have people like you and these clinics opening up all around Australia.
Yeah.
And
because
there's period pain is just so not normal, and pelvic pain is not normal, and you don't have to live your life in pain.
And even if you don't fit an endo or PMOS or adeno tick box, like, you have pelvic pain, we need to help you. And there are like really important players in the field as well, and in the team. So psychologists that specialize in pelvic pain, dietitians, naturopaths. Some people really benefit from like Chinese acupuncture for endo or the nervous system. There's lots of options that people can go to.
I have some questions from people I have an endometriosis group chat. There's 160 girls in there.
Yeah.
And they have written in, one of them was asking, why do people clench their pelvic floor without realizing?
So I guess a lot of people find this analogy helpful. There are a lot of people that get neck pain or like jaw pain, or they feel like, oh, I'm always clenching my shoulders. We definitely notice in a lot of people that they always will clench not just their pelvic floor muscles, but their belly. And I've found that with most of my pelvic pain patients. I'll watch them while we're chatting, and I'll look at their belly and say, can you let your belly go? And they actually find it really hard to do that. And they find that it's their resting state. So rather than being relaxed in the chair, they're constantly clenching. So that is called overactivity. Your muscles can be overactive, and they can be really tense and have high tone, which sounds like a fit good, but it's definitely not helpful. And it can make muscles really, really sore and like achy to touch. Muscles that are overactive and really tense, they lack blood flow, so they're really prone to spasming.
I just had a flashback of you at the retreat. Amelia came to my retreat in WA, and you were getting everyone to relax your belly while we were doing yoga. You're like, let it go, let it go. And you brought it up quite a few times. So is that something that you personally practice throughout your life?
Oh my gosh, yes. Like, I'm wearing this fancy outfit and I just want to take the button off so I can let my belly go better. So that's part of my advice for people as well. It's about the clothes that you wear. And essentially when you're doing stretches or like after exercise, a lot of people with pelvic pain are fearful of exercising and movement and flaring their symptoms. And so me as a physio, I really care about people still moving their bodies, feeling strong, but then having nice options to do afterwards. We don't have to tense our muscles all the time. It's okay to use them for exercise, but some people that have that high tone and they're prone to spasm, I'll go through a whole routine of what they can do to help relax the belly and calm the muscles down. And yes, I've never had a patient with pelvic pain who has tried a stretch that I've given them and not been tensing their belly. So I'm really obsessed with cueing belly relaxation, pelvic floor relaxation with everything I'll get my patients to do, whether it's stretches, self-release exercises. They're always tensing it
because they're self-release.
They're anticipating pain. Oh, so self-release exercises. I mean, if a physio is doing any hands-on treatment, so like releasing like hip flexors, inner thighs, or muscles in like the hips, that's really common. We want to give patients something that they can do to help maintain that. So using like a trigger ball, I love to show people how to use a trigger ball or a foam roller on the inside of the legs, or use their fingers to help release their hip flexors. Because what I'm going to do for you once every 3 weeks might not be very helpful if you can't maintain that yourself.
What's your thoughts on people using Kegel balls and yoni eggs?
I mean, I seldom have ever given that to a patient, but that's because I find that we have so many options for pelvic floor exercises and strengthening. We can make it really functional. That I just haven't had to resort to that. There is a place, but certainly not for pelvic pain. You don't want to be trying to make something like, we don't want to have the biggest emphasis on strength and holding and having weight on there. We want to more tune into coordination, getting blood flow in the muscle, helping the person learn what is on, what is off, and also how to let it go. And I teach people belly breathing. Diaphragmatic breathing is what most people will call it. And that's how people can really relax their muscles well. And we want to make that functional. So I'll teach them how they can apply that with trying to insert something vaginally or rectally, for example.
How does pelvic floor physio help with intercourse?
Yes. So intercourse, I guess we're talking like
P&V.
P&V, it could be a toy, it could be a finger, anything, or it could be inserting a tampon. Okay. So for instance, there are muscles at the entry of the vagina. So you have these ones, they're kind of in a circle, and then you have muscles that are, so these are the ones at the entry, but then if we turn them this way, you have muscles, they're like a sling that go around the anus as well, the rectum, and this muscle is often the one that lifts and makes people feel like I can get something in a little, but then it feels like I'm hitting a wall. It's often this guy, puborectalis, pubococcygeus, so this sling of muscles. And so when you learn to let those muscles go properly, it can be much easier to insert something. There are positions that are easier than others. There's also a vaginal angle. So I've taught many people how to actually just insert something that is in line with the angle of the vagina. There are so many people that are inserting something upwards and towards the bladder. And depending on your uterus, if it's anteverted or retroverted, sometimes people's cervix can be touched a lot easier. And not everyone has a really tender cervix or experiences pain with moving of the cervix or the uterus, but some people do. And so we can try and figure out what is the cause of your pain. Is it the muscles at the entry, the deep muscles? Is it movement of the organs, sensitivity of the vaginal walls? And then we can help get you treated for the right thing. Does that make sense? Because there's superficial pain with intercourse and there's deep pain, and those two might require very different treatment options.
Do you think it's hard for people to bring this conversation up with their partners?
I mean, Yeah, I think it's hard to talk about. I think like there are some couples that feel really lost, and if you're not able to understand what it's like, sometimes you don't understand why your partner's libido doesn't exist anymore. But I say, I'm like, well, of course you don't feel like you have much desire, because what the consequence is pain for you. Like, why would we desire something that we know is going to be painful, or we feel like we're on guard all the time? So there are some great options for deep pain with intercourse. Sometimes it's learning what angle is best for the pelvis. Sometimes it's actually just minimizing the depth of penetration. And I actually have a device here, which these are like stackable rings. They feel really nice. They're stretchy. And if the thing that's painful is your cervix or movement of the uterus or bladder, like some people will say I have abdominal pain when I'm having deep penetration. And it's like, okay, well, that thing probably doesn't love to be touched or moved at the moment. There are treatment options for that, but like a really easy solution, which I think everyone should have in their bedside table, is something like this. You can look them up as penis bumpers, or this is the O-nut.
Yes. The O-nut. I feel like it should be an accessory in everybody's drawer.
And you can use it for, toys. And I think like, if you imagine you're like, wow, I'm not fearing pain anymore, you're going to be much more likely to enjoy having intercourse.
Absolutely. I just think about people in other countries that are in arranged marriages that don't have this education. I just feel so sad for them, where they might be, have a partner that's not so understanding. I think it all comes down to education around it. That's why I'm so glad we're talking about it, so that we can understand that like this pain is real and you're not making it up in your head, and you should be able to discuss it with your partner. And there's so many other things that you can do until you heal yourself.
Yeah. And I think like we see online, unfortunately, a lot of our sex education is what we see online, and we think that there has to be full penetration. It's like, I explain, I'm like, there's actually barely any nerve endings at the base of the penis. They don't need to go in all the way. And although what you might be seeing on certain types of things online, like the deep penetration, they're acting like, or they are portraying that it feels really good, there's a lot of people where that doesn't feel good for them. And so using something like this, or just being in less penetrative positions, can be much more pleasurable. And I think a big red flag is if someone doesn't want to wear this or try this for their partner that is like clearly in pain. Unfortunately, I have seen that, but I'm not going to tell my patient that that's a red flag.
You're just like, honey, like waving the red flag.
But so many patients are like, oh, okay, I'll have to chat to my partner about it or something. Like, and you know what? I have found like so many beautiful partners are like, hell yeah, I'll wear that. Let's do it. Let's try that. And then sometimes that can just be such a great solution. It's not always the solution, but
it's why not try it? What other weird things do you see on TikTok?
Well, I mean, I think like we just often see like people doing squeeze, let go, and they're telling people to stop what they're doing and squeeze. And like, I think that's bringing an awareness to people that there is a pelvic floor and that it's good to use it. But essentially, that might not be the right exercise for everyone. And I think we're commonly always being told, do your Kegels. I have a lot of patients that are told by their mothers who have prolapse, for example, or who are incontinent, squeeze your pelvic floor. And the daughters are so scared of what their moms experienced. And so they then are doing that too much, and they have consequent high tone and overactivity. So we want to have a balance. You don't need to squeeze your muscles all the time. If you're doing pelvic floor strengthening, there is a limit to how much you should do, and just trying to squeeze isn't right for everyone.
Yeah, I do see those videos on breathe, let go, squeeze, let go. I do follow one person, so it's good to know that. Not saying you shouldn't do it, but it is good to know, because you can easily fall into these traps of seeing someone that you love on social media telling you to do something. It's a slippery slope. Or even selling, the Kegel balls. I have them in my shop, so I'm not saying that they're bad, but you do have this fear of like having a prolapse But it's so common, isn't it? I've done it on my social media. I've got, as always, group chats for people with prolapse, and there is so many people that have a prolapse.
Yeah, totally. And, on social media, you can only record a video that's a minute.
Yeah.
Right. Or you lose engagement, or you have to post multiple. And like, I seldom would ever have a program, even if it was for strengthening and strengthening was right for that patient, that's a minute. So if you are strengthening, just like everything, you're not doing 3 squats and then calling it a day. You need to load something to fatigue, and it's not going to do that in a minute.
You need to go learn about all the other things from you, such as the nervous system.
Yes.
Does that affect the pelvic pain?
Yeah. So a lot of times, like, our job is to figure out what is reproducing your symptoms. Is this muscle pain often, or is it the nervous system? There are some signs that the nervous system might be more sensitized. And that is like a really undertreated area of pelvic pain. And I think it's something that is coming onto our radar more and more. The reality is, when you have pain ongoing, when you have trauma, it's very likely that your nervous system is going to be affected. So, you're on high alert all the time, and it can cause you to feel, sometimes you can feel nausea, lightheadedness, dizziness. You can feel like you have a new sensitivity to external stimulus like lights and noise. You can feel more anxiety and stress, and especially with anxiety and stress, or even just excitement, you can have flares of pain as well. When I'm assessing people, I mentioned that there's the tenderness around the vagina, but there's also like hypersensitivity of the abdomen. That's really common. And so we want to, and that's not the nervous system. Those are the nerves, like the nerve endings at the end of the system, basically. But we want to figure out all the different components to people's pelvic pain. And
Can you show us how to use the TENS
machine? Yes. So I actually have it on now. And firstly, so the top 10s, they come in a unit. This is my favorite sticker that they have. And it's because it's like in a nice, the sticker goes along like the base of the bladder, the uterus, really nicely. So you can put it on. There's 5 modes. And basically, I like to show people how to use the different modes and just see like what feels good for you. So I'm turning this up, and I feel like it's kind of like a staticky feeling. It's constant. And like, I was showing my roommate how to use this the other night. She has endo, and she hated that setting. But then I put it on the second one, and that was constant but slightly different, and she loved this one. And so, try and figure out the sensations. If you're worried about if you're feeling like, oh, maybe it's too sensitive, just keep it on a very low mode. This mode is actually going like up and downs very slowly. The third one, so these are for pain relief. So it helps distract your brain from pain by giving it a different type of signal.
Wow, that's incredible.
Yeah. And so now the third one, it's going like, and so sometimes people will wear this for a few hours and they'll feel like, oh, it's not really working anymore. It's not masking my pain as effectively. And it's because our brain gets used to that repeated stimulus. So we just want to try a different mode. And my fave as well is the 5th mode. So this is the desensitizing mode. And they have a lot of resources on the website. This is by all means not a full tutorial, but this is so key for desensitizing muscles and skin around your tummy area or wherever you experience sensitivity. And they have little teeny probes actually that you can also put around here, and that helps with that vestibulodynia that I was talking about. And basically this is like a non-medication option for desensitizing. And there's good evidence on people with endo and abdominal hypersensitivity that if you use this for 30 minutes a day for 12 weeks, that it's going to be much less tender to touch. A lot of my patients will feel like, oh, I can't like wear tight clothes because it really bothers my tummy. And yeah, I experience that too, because I get bladder pain intermittently, and I love this for my pain. Like I can't tell you how many days I've been able to actually work just because I've had this.
So just say for me personally, because I get period pain, but it's only once a month on like day 1, day 2 of my bleed, would I wear it every day or just during my bleed?
So if
when the pain is,
if you're not feeling any hypersensitivity, like you don't generally, like you can touch the area, it's fine. Like you don't have those sensations like I was describing, then I would just say for pain relief at the time. Yeah. And you can have this while you're having like your oral medications, if they help pain relief medications. It's a great tool in the tool belt. And like it really is discreet. Like you can't tell I'm wearing it, right?
It's great. Yeah. So you just recharge it and then you can pop it on and wear it under your clothes to work or to the shops. Or...
And once you learn the settings, you can like turn it up under your clothes.
Your face.
I know. They have a really good one. This is the sticky thing for the back. And they have ones that connect, and like these are really nice because you can like make them really wide and you can do like your ovary area. Or like front and back.
Is ovary pain part of endometriosis?
So, I mean, a lot of people can have ovary pain as well as endo. You can have endo on your ovaries. You can have painful ovulation.
Yes, painful ovulation. Sorry, that's what I was meant to bring up.
Yeah. And some people just feel like they often say, oh, I have pain in my ovaries, but then I'll assess them and I'll realize like it's actually your hip flexors that I'm saying is that they're like, that's my ovary pain. Or sometimes you'll do an internal assessment on the pelvic floor and they'll be like, that's my ovary pain. And you're like, oh, that's actually your pelvic floor muscle or your hip flexor muscle. And yeah, often it might be that both are painful, and at least the muscles is something we can do something about.
Ah, good. Oh, everybody needs to go and see you that has any form of pain.
And yeah, look, I think like we're lucky in Australia that we do have more pelvic health physios, but not everyone is trained to see people with pelvic pain. And it is expensive if you are seeing someone privately. So you can go to your GP and get a GP management plan for something that is like chronic or longer than 6 months. That's pelvic pain, right? And that can help with the cost as well. Medicare covers, I think it's $65 now for 5 sessions if you get that for that clinic. But yeah, I think anyone with persistent pelvic pain should have 10. You know, you can have 10 mental health care sessions a year.
Yes.
We should be able to have that. And that's why I made my app as well, was because I do believe that there's some key education like what we're talking about today. And there's so much more we could have covered. And we shouldn't be gatekeeping this information. You know, it's not right for everyone. But if I had a patient that had listened to the education and they listened to the video about the TENS machine, that saves so much time when I'm there in person with them. We can make the most out of our session. They might say, oh, I've tried this belly breathing and I tried to do the pooing strategies you mentioned on the app, but it wasn't working. And I'd be like, great, like, let's troubleshoot why. Let me see what's happening. And then I'll make it more individualized for you.
Yeah, and as I said at the start of the episode, it's only $20 a year. It's so accessible. And that's what we want. We want this education to be accessible to everybody.
Yeah, and I think we all want to try exercises ourselves sometimes. Like I seldom have a patient saying they've never tried anything. They always look something up. And so, yeah, you can look up Pelvy Patient and you can go to the Learn section and you can learn about the coordination exercises I'm talking about, the belly breathing to help relax, and the strategies for pooing. Like improving your bowel habits can make such a difference, not just for pelvic pain, but for people that experience prolapse, leaking. If we're constipated and straining on the toilet, that really impacts our pelvic floor symptoms.
Can you give us some just before we finish up?
Yes, I love to help with people pooing. I don't know if they can see this really well, but essentially this is someone that is sitting in a really nice pooping position. And what's important is that you have your knees above your hips, not on your tippy toes, because that makes you tense through the back part of your legs, which actually squeezes your pelvic floor. And we want wide feet, wide knees. We want to have our belly nice and relaxed. And this is something that people with pain really struggle with as well, but I want you to try to widen your belly. So let's widen our belly as we breathe in. See, that's hard for you, isn't it?
Yeah.
And then out. And then just gently try and widen it again, this lower belly. Good. And then imagine you're trying to do a poo, and most people will go to like bear down and then they'll go. And if we're tensing our belly, we're tensing the pelvic floor muscles, and they literally wrap around the rectum. So they will cut off the poo and they will make it harder for you to poo. I'm not saying this is the right thing for everyone. There are other reasons people can struggle to empty their bowels, but this is definitely worth trying. And so we go through a lot of troubleshooting on how to empty better, and it's life-changing. I personally struggled with constipation my whole life, and I was like, I've just learned how to poo properly. I'm 25. What the heck? But yeah, we want to widen and then keep it wide as we're generating that pressure. And if you learn how to let your pelvic floor go, you can combine those two, and hopefully it can come out a lot easier.
And I got my first poo stool only like 3 years ago.
Yeah.
And that's the best thing I ever bought. I just have this little stool that sits in the, well,
in the van.
Yeah. This is actually at my sister's house, but at my van, I get my portable toilet and I put it in the alley, and then I put my feet up on the step.
Yep.
And I always poo with my feet up.
Yep. I
So,
love that for you.
Tell me I'm a good girl.
You're such a good gal. And yeah, it's just, I think like, even though it's kind of awkward, you know, if we can improve the way we're pooing, like straining on the toilet literally causes so many symptoms: prolapse, hemorrhoids, fissures, and it shouldn't take us that long. It should take 2 to 5 minutes.
All the boys that are tradies in the bathrooms, or
Yeah, they're not pooing though. They're just on their phone.
they're scrolling.
Yeah.
What do you think about scrolling on the toilet?
Yeah, I mean, I think get off the toilet, do it somewhere else. The toilet is for pooing, and I totally catch myself doing this too, by the way. Yeah. But it does place unnecessary pressure there.
Yeah.
And let's get in, get out. If you're struggling for more than 5 minutes, there's a reason, and you can have help for that.
Oh, well, thank you. It's been so nice having you on, and you're so educated and good at what you do. And I think the key points are: get a TENS machine.
You have pain? Yes.
You're in pain. Go to your GP and get the 5 times you can see
The GP management plan. Yes, you book a GP management plan appointment, and
go see the specialists.
Yeah, if you're looking for a pelvic health physio, you can. So pelvy.app is my website, and we will soon have a clinician directory, and it will have people's interest areas. And if they have pelvic pain on there, then that's a great option. And all of the clinicians do telehealth, like everyone. And telehealth can be really effective for people with pelvic pain as well, and really nice for someone actually who has a bit of trauma and who's quite nervous to be like in person, or we're not sure what assessments to have. If you started off in telehealth, that's a great way to build rapport. But yes, I also want to feature what clinicians have for assessment tools. So the ultrasound machines, because they're like $5,000. And I think if you don't have an ultrasound machine or like a biofeedback machine or something, like you are maybe more likely to do internal examinations. And so like, especially for kids, for men, like you actually need an ultrasound machine. So you can search people based on the equipment that they have, if they're local to you.
Oh, that's very cool.
Yeah, because we have 95 clinics using Pelvy with their patients. And so, yeah, they'll be able to search and find someone near them.
Great. Thank you so much.
No worries, Ellie. Thanks for having me.
Thanks for coming.
Anytime.
Do you want to do, it will cut there, but do you want to do like one reel for Insta?
Sure.
That's just like facing there with one of your things.
What should I do?
Honestly, anything that's like clickbaity that I can like comfortably with Cam.
Yeah.
What time is it? Oh, we're 2:05. Just do one.
We got in late though.
Oh, did we? Okay, cool.
Okay.
Just do something that's clickbaity that's like I can put as a real advertisement for the podcast.
Okay, so
Like one of the most asked questions
yes.
using your things.
Yeah. Okay. All right. Okay. Do you want to know why you might have superficial or deep pelvic pain with intercourse or inserting anything vaginally or rectally? Because we're talking all about it.
Something that's less like leading to the podcast, something that's educational.
Yep.
Like, that's got like a finish, like something that they learn from.
Okay. So like a strategy, like
Yeah.
like how to, like one of the exercises or something?
How to poo or something. Although I can take that from you. Something's like, one of the exercises.
Let's do a coordination one. Yeah.
Yeah.
So I mentioned coordination exercises for learning how to relax and turn on.
Let's do that.
Okay.
It's going to be real.
Okay.
To me. It's gonna be just you.
Yeah. So let's try a coordination exercise. This is helpful for pain and just learning how to use your pelvic floor. So imagine you're squeezing and closing around the anus or vagina or base of your penis, and then you're letting it go. And we're going to do it with breath. So breathe in and relax, and breathe out and squeeze. Breathe in and relax. Breathe out and squeeze. And that might be a good place to start for pelvic floor exercises. So I don't mind my TENS machine here, but we're going to practice letting the belly go. So I want you to take a nice deep breath, widen your ribs and your lower belly. And then just let it fall, breathing out. Widen the ribs, lower belly. Can you see how my fingers come apart? And that's it. This is called belly breathing. And if you look at it, use a mirror or use your hand underneath here, you might be able to feel a slight softening. It's like something is slightly pressing into your finger. And that's because it can help soften the muscles all around here.
So I now want everyone to repeat after me. I am unique. I am worthy of pleasure. My body is mine. I am comfortable in my skin. And remember that I love you.